All right, so for this next aspect of respiratory distress syndrome is all about the prevention, right? So how can we be able to prevent this disease condition from coming in? So most people say prevention is better than cure, right? So on the prevention side, and of course you know that respiratory distress syndrome can occur in newborns, can occur in older children, and also adults. So let's quickly look at ways in which we can be able to prevent this disease, from coming in. So for newborns, since it is common in premature infants, avoiding early delivery is the key. So even if it is inevitable for you to give birth to the baby before its time, just try to give birth to the baby close to its time. Okay, so you try to manage all those underlying mother issues that will possibly cause complications in the lungs of the baby, like diabetes, hypertension. Then you can also use a type of drugs or a class of drugs known as tocolytics. These ones, they will delay labor. Okay, ensure that there's access to quality prenatal care. All right. Then antenatal corticosteroids, those ones they give it to the mothers. That's if the mother is at the risk of preterm delivery. Okay, between 24 to between 24 to 34 weeks of gestation. So stimulates fetal lung maturity and surfactant production, reduces risk and also severity of the respiratory distress syndrome overall. Okay, so moving to the next one, you can also give surfactant therapy. You know that most of these children, they have issues with their lungs staying patent, staying open. Do you understand? So the lungs is now collapsing on itself. So or there's like accumulation of fluid, so the baby is not being able to breathe properly. So you can now give some exogenous, that's man-made surfactants. We just spoke about corticosteroids, right? So you give surfactant so that they can just help to keep the alveoli open so that the baby can keep breathing properly. Okay, then you can use continuous positive airway pressure. Okay, so it helps to maintain alveolar expansion, reduces need for mechanical ventilation and surfactants in some cases. So in older children and adults, mostly respiratory distress syndrome is usually caused by some underlying disease conditions: sepsis, pneumonia, influenza, COVID-19. So just try to prevent these other diseases, okay, and you tackle it. So avoid any risk factor, okay, transfusions, okay, and the rest of it, okay, trauma, transfusions, aspiration. So in older people, it's just more of like preventing what will lead to the respiratory distress syndrome. While in newborns, it is inevitable for them to be born, before their time. So you have to just bring in some other things that will help to stabilize them.